Hello, I'm your host, Kari Johnston, and this is Yukon First Nations COVID Response One Yukon podcast series. I'm joined today with Dr. Katharine Smart, who's calling in from the traditional territory of Kwanlundun First Nation, and I'm joining you today from the traditional territory of Champlain and Ajax First Nations in beautiful Yukon. Good morning, Katharine.
Good morning. Nice to see you.
Thank you. And today we're going to talk about the pediatric vaccine, the vaccine for those under 5. It's been a long time coming. It's so exciting that we're finally here. Could you tell us a little bit about it? It's the Moderna vaccine.
Yes, absolutely. Yes, I agree with you. I think there's a lot of parents of kids under 5 who have been anxiously awaiting their chance to have the option of having their child vaccinated. And it has been a long time coming. And we know the data was submitted to Health Canada in April. And I think since then, a lot of people have been really anxiously awaiting their decision. So as you said, it's the Moderna vaccine at this point that's been approved for kids up to 6 years old, because Moderna before wasn't approved down to 5. So it's 6 months to 6 years. And it's a quarter of the adult dose, half of the child dose. So it's 25 micrograms. And it was approved on the schedule that was studied by Moderna, which was 1 dose and then a second dose 4 weeks later. But similar to kids 5 to 11, NACI has recommended a longer interval, so 8 weeks between the first and second dose, because of really the evidence that they've been able to show from their vaccine work that that interval tends to produce a longer and robust immune response. So they're thinking the same for younger kids. The studies were done during the Omicron era, and what they really looked at to determine whether or not to approve this vaccine was whether it generated a similar immune response in terms of antibody levels to what we've seen in children and adults with the similar vaccines, but of course with this lower dose. And that's what they showed. It did show a similar antibody response and a similar reduction in getting infected with Omicron. So about 54% in the younger kids and almost 40% in the slightly older kids. So that's similar to sort of the performance we're seeing for the vaccine right now in kids and adults. And now that we're into the Omicron era, of course, one of the most important aspects of vaccines is preventing severe disease and hospitalization. That we don't have that data yet on this age group, but what we do know with Omicron, of course, so many more people have become infected because we've got a very contagious virus when we've seen sort of a backing down of some of our public health mitigation strategies. So that's led to widespread infection. And as part of those numbers of people infected increasing, there's been a lot more younger children seeking care in hospital, whether it's in the emergency department or requiring hospitalization, and in some cases ICU. So even though overall those outcomes for children are rare, they do happen. And it's really nice to have the option of a vaccine to try to prevent those more serious outcomes.
What would you tell, or how would you relate to a parent who's concerned about their safety? Is this vaccine safe? What would you tell them?
I think what we know is the vaccine is very safe in all ages, and that's what we've seen so far. Of course, just like what happened with kids 5 to 11, this study is based on a smaller number of children. So if there's rare adverse events, we wouldn't have necessarily seen that in the data we have, but we have no indication that we would anticipate that from what we know about the vaccine or what we've seen in that 5 to 11 age group, which is reassuring. And that's again another reason that NACI was recommending that slightly longer interval, is they had some signals from other data that reduce the chances of some of the very rare complications like myocarditis that we were hearing about in adolescents. And we've really not been hearing about that in kids 5 to 11. And again, that would be very rare in younger children anyway. So I think with the lower dose of the vaccine, the longer interval, the risk of that would be very low. So we're anticipating good safety from what we know so far. It appears to be safe, but like with every new vaccine, there'll be ongoing really close monitoring to make sure that if there's any rare events that weren't picked up in the initial trials, that we're paying attention and looking for those things.
Any tips on how parents can help prepare their kids for the shot? Any medicines that they can take or topicals or anything like that?
Yeah, that's a really important question. I think sometimes one of the scariest things about vaccinations for families is just the experience of it, right? Because of course, kids don't like needles. There's lots of things parents can do to set their child up for a successful experience with immunization. I think the first thing is how you sort of frame it and talk about it. It's really helpful to inform kids. And, of course, if you have a 6-month-old or a 12-month-old, you're not going to be doing that. But if you have a 4 or even 3-year-old, you can have some conversations about what to anticipate, that you're going to get your vaccine, and it's important to keep your body healthy. And that, yeah, it's normal to feel a little bit scared, but mom or dad or caregiver, whoever, whatever family member is going to be there as the support person, loves you and they're there and they know that you can do it. So often, really just that positive framing for children really helps. There's other things you can do to help with pain. So there's a topical treatment called EMLA that you can buy over the counter. That's a skin numbing cream. So if you have a child that you think is particularly sensitive to needles, or you're just worried about that, you want that extra layer, you can use EMLA. That can also be quite useful. I think also taking something for distractions really helpful for kids. So even something as simple as being able to watch a little video on an iPad while they're having the vaccine or being read a book, those distractions can really just shift our mind away from what's happening and onto something else. So that really helps. And then a bit of a reward, right? Letting them know, hey, I'm really proud of you. I know you can do this. We're going to do something to celebrate how brave you are after. And that could be anything, right? From a sticker to a walk or an ice cream cone or whatever you want to do. But it's just, again, that positive reinforcement to reward the child. And it, again, builds their sense of self-efficacy. Those are all things I think that can be really helpful.
We've been using a lot of ice cream as a reward in this household for potty training these days. Oh, I might have lost you.
Yeah, it works, right? It's all of us. We're motivated often by external things. Oh, did you leave?
Oh, we got a little bit of a delay, but I think we're back in. Yeah, ice cream works wonders, especially.
Okay, perfect. Yes. I think all of us, are adults included, often do well with a little bit of external motivation.
Right. Anything that we need to think about in terms of preparing kids post-vaccine? Like, do we see some sort of immediate side effects from the vaccination?
Yeah, so similar to other childhood vaccines, the most common side effects would be a bit of soreness at the arm, sometimes a bit of redness where the vaccine was injected, and that's really normal. And the other thing we can see sometimes is fever, and that just tells us that the body is responding to the vaccine, starting to make antibodies. Younger children are more likely to get fever with any vaccine, and that's just because their immune systems are so able to generate a great immune response. So if it's bothering the child, they can have some Tylenol. If it's not bothering them, it's nothing to worry about. Fever in and of itself is not dangerous. It's really just we treat that symptomatically for comfort. But many children with a low-grade fever feel absolutely fine and carry on. If your child's not feeling fine, they're in pain, they're uncomfortable, they're not eating or drinking, then that's a good time to use something like Tylenol to help take the edge off.
We see a lot of sort of misinformation or speculative information out there about long-term effects of the vaccines. Is there any merit to any of that? Like, are they seeing any long-term effects?
No, we aren't. I mean, the only long-term effect we're seeing is ongoing excellent protection against severe illness and hospitalization, which is fantastic because, I think when the first vaccines first came out, of course, I think we were really optimistic that they were going to dramatically change the spread of COVID. And of course, as the virus has evolved, that part has changed a bit. Absolutely still helpful to have a highly vaccinated community because it does blunt the spread, but it's not as impactful as we were initially seeing with the original strain. But what hasn't changed is that protection against severe disease and hospitalization. And, I certainly recognize that's not the only impact of COVID, but it's of course one of the most concerning ones. So that has been really robust and ongoing, which is, I think, really reassuring, especially as the virus has changed a lot since the beginning of the pandemic, that we're still seeing that with our vaccines. But we haven't seen any indicators that there's any other long-term concerns or changes to any aspect of the body from the vaccine that should be worrisome to people. I think that is a real challenge of the misinformation movement, is they sort of prey on those concerns for people. And it's scary when you hear that because you're not sure what to believe. And there's a lot of conflicting narratives right now out there about the vaccine and its safety. But from what we're seeing on my side of the fence, it's looking very safe and, again, ongoing effectiveness. And I think what's important for parents that are listening, or any adult that's listening, is what's really critical right now is making sure you've had at least 3 doses of the vaccine. That protection against severe disease and hospitalization for adults requires at least 3 doses. And we know that our population is quite highly vaccinated with 2 doses, but we're lagging somewhat with that 3rd dose, and that's really, really important.
Mm-hmm. Does the vaccine prevent long COVID in kids, or what do we know about long COVID and the vaccine?
Yeah. That's a great question. So I'd say, a few things about that. I think right now long COVID is really challenging because we know it's out there. We know it's an entity. What exactly it is challenging because when you look at different studies, it's been defined in a lot of different ways. Anything from, someone who's coughing 6 weeks later up to someone who's having, brain fog or fatigue or cardiac symptoms, a year later. These are obviously two very different things. The studies on long COVID in children have also been quite challenging in what they've shown. So some of them have shown a really high prevalence. A lot of the better studies have actually shown a very low prevalence. And I think the biggest thing we've learned from studies on long COVID in children is how common vague sort of symptoms are in kids. And by vague, I mean things like fatigue, headache, abdominal pain, mood changes. It's actually, those symptoms are highly prevalent in all children. And I think that's reflective of, the ongoing mental health crisis that we're seeing in our population, and also just the impact of the pandemic on children and youth overall. So it's been challenging to tease out, the difference between the population in general and long COVID, although there are some children that seem to be having more significant symptoms. So I think overall what we're learning is, long COVID in terms of, I think what you would worry about as a parent, meaning, significant disability for your child that's ongoing. That seems to be very, very rare. There's been some evidence in adults that the vaccine maybe prevents that. I think it's right now, again, we're not really sure in children because we just don't have the data. And again, in younger kids, it's even harder because we don't have a lot of great data on what long COVID even is. But I certainly don't think what we're learning is it looks like it's the prevalence that people were initially concerned about. So I think that's reassuring. But again, it's not zero, right? So again, all of what we're trying to do here is balance risks. So my view would be, I think the vaccine is safe and effective. And I think if there's any chance it helps with any long-term complication, given the fact that it's safe, on balance, I think the safer choice would be the vaccine.
Are COVID reinfections sort of like a concern now that we're sort of in this living with COVID phase and we're hearing of repeat infections? What do we think about that? Or what do you think about that?
Well, we're definitely going to see COVID reinfections because COVID is with us now, right? It's not going away. It's going to become one of the viruses that are part of our world. And we certainly see with all other viruses that people get reinfected with them. So we're definitely going to see that with COVID. It's also very clear that COVID is still evolving. Even with the Omicron era, we're now on to, our fifth or sixth version of what we're still calling Omicron. So there's still rapid change of the virus itself. So I think there's no question that we're going to see reinfection, just like we do with lots of other viral illnesses. The question, I think, is what does that mean for people's health long term, right? Is that dangerous? Is there a risk those infections are cumulative? Is it getting more serious or is it getting less serious each time you're infected? That we don't really know. We are seeing, studies are showing that if you've been both vaccinated and you've had COVID, you seem to have more durable immunity, and again, the protection against those severe outcomes that people are worried about. So that's reassuring. But I think the reality right now is we're still learning a lot about this because it's changing so quickly. So I think that's, again, I would imagine disconcerting for folks, right? Like when you're a member of the public and you're just constantly hearing all this different information and people saying very different things, it's very confusing. I find it confusing as a healthcare professional. So I can only imagine, how someone feels who's maybe not a healthcare professional. And I think it's tough to kind of know what to make of all of it. But I think, the main message is we're learning, we're doing our best to give the advice based on what we know. But where, what it's going to look like in 3 months, 6 months, 12 months, I don't think anyone really truly can answer that.
Yeah. For a parent who's trying to make the decision on vaccinating their kid and when, so for example, for me, where my kid just got COVID on Thursday. And so we're just, 2 weeks before it rolls out in the territory. How long do I wait? Do I go do it right away or do I wait a period of time?
No, that's a great question. I think it's an important question. And again, it's something we're learning about, but I think on balance, I think what the evidence is showing and what NACI's telling us is there's no benefit to being immunized right after you've had the infection. So, for your situation where your child's just had COVID, you'd be better to wait at least probably 3 months. The reason for that is what you're trying to do, particularly with children, because, they have a long life ahead of them. And again, this version of coronavirus probably not going away. So we really are trying to create the most durable, long immunity for them that we can. And what we know is when we give the vaccine really close to just having the infection, we're just not seeing any real benefit from having had the vaccine in addition to the infection itself. Whereas if we wait a few months, then we start seeing that cumulative benefit benefit on your immune system and the durability of that response. So, you know, and if that was me, I would wait at least 3 months to get the vaccine, because I just don't think you're going to see the benefit of it right away. And I think you're going to see more durability. The other thing I think is important, and what we're learning is, of course, you know, again, there's those two aspects to the vaccine, right? One is preventing getting infection. One is preventing severe outcomes. And what we know is, you know, we definitely are seeing, of course, less efficacy in terms of just preventing infection itself. But again, it's not horrible, right? 40 to 50%, that's not bad. But we know that aspect of it wanes over time. So if you were to get the vaccine right now, you know, in 3 or 4 months, that impact is going to have waned away. So if you wait 3 months and you get it, then you're going to give yourself sort of another 3 months where you've got that more robust immunity and less chance of reinfection. So I think it's sort of, you know, making your decision to optimize what you're going to get from the vaccine. And that's, I think, why we're seeing that advice from NACI. And there's good evidence that natural infection gives you reasonable immunity for a few months right after, and protection against bad outcomes. Mm-hmm, mm-hmm. Now, I would say one maybe caveat to that, might be a different decision if you had a child who was immunocompromised or had underlying medical conditions, that then the risk balance of that would be less clear. And I think you would likely want to proceed with vaccination. But for most parents who don't have a child with a rare condition, you know, following that advice of waiting would make sense.
So we've been talking a lot of, you know, in the last year or so around vaccine hesitancy and what that sort of means. And, you know, do you have any advice for parents who are maybe navigating a space where maybe one parent is vaccine hesitant, or, you know, they've got other family members, or they're part of a peer group where there's a lot of vaccine hesitancy? What advice would you relate?
Yeah, I think that's really challenging. And I think it's, you know, obviously it'd be the most challenging if it's within your own family. And then, you know, but also challenging if it's with extended family or friends, because it can be a source, I think, of a lot of arguments and, you know, discomfort, and nobody wants that, right? Like, we want to feel like we're connected with each other. We want to feel respectful of each other. And I think things like vaccine that can be quite emotional, especially right now when we're still in this pandemic, it can be hard sometimes to navigate that. I think, you know, especially if it's within a family and it's leading to a concern about the decision for your own child's health, I would really encourage people to maybe bring that conversation to a healthcare professional who can help answer the questions that you may have if you're struggling to decide. You know, one parent wants to vaccinate, the other doesn't. I think that's quite helpful. And that person is a bit of a neutral person that can answer questions, give good information, and hopefully that helps the family with a decision. I think, you know, when you're outside of that, you know, it's not maybe impacting your own decision making, but it's more just that discomfort of disagreeing. I think that is challenging, and I think it's really a matter of listening with compassion, understanding what people are saying, and trying to just offer your own view. You know, hey, I hear what you're saying. I hear your concerns. Are you interested at all to hear my concerns? That's the other thing I think I've learned over time is, you know, to share your opinion, people sort of have to be wanting to hear it. If they're not interested in what you have to say or your perspective, there's not a lot of value often in sharing it. And I do that myself as a healthcare professional. When I see a family whose child's unvaccinated, I bring it up because I want them to know I'm totally open to the conversation. And from my perspective, you know, I always know parents are making their decisions with their child's best interest in mind. And if they've made that decision, that's how they feel. But I want to make sure that I can share what I know as a pediatrician. But I always ask their permission, because some people are open to that conversation and other people really don't want to have it. And in that case, it's not a valuable conversation. So I think it's about that mutual respect. It's about discussing what the boundaries are and trying to have that transparent communication, recognizing that the end goal is to maintain that respect in the relationship and maintain the relationship with people that you care about.
Mm-hmm. Mm-hmm. What impact do you think misinformation is having on vaccine hesitancy, both with COVID-19, but then maybe also with some of the more routine childhood vaccinations?
I think the impact of misinformation cannot be understated. You know, recently the World Health Organization actually said that the parallel infodemic, or spread of misinformation, is as dangerous as the pandemic. And I think that's really, really true, actually. Like it's I think at the beginning, it was sort of a fringe thing that was happening. There was, you know, we've always had people that didn't believe in vaccine science. That's not new, but it was a small number of people. And it's grown over the pandemic. And I think that's just because of how effective people who spread misinformation have been. And I think even if they haven't entirely drawn people into their camp, they've sown enough seeds of doubt that it's left people not making a decision to vaccinate. Even if they're not in the camp of being totally against the vaccine, they're just stuck with indecision, which is equally dangerous. So, and I think the reason it can't really be understated is all you have to do is look at the difference in outcomes between the United States and Canada, where we have a dramatically higher vaccine rate, and they have had such a higher rate of death than us because of that. So these, people losing their lives because of this decision, that to me is really scary. And there was some recent polling done by Abacus, which is a polling company in Canada, that was kind of asking just the general population some of these questions. And I thought it was actually quite shocking what came out of that. They asked two questions that I thought were interesting. One was just asking Canadians, do you think information about complications or death from the vaccine itself have been withheld from Canadians? Is there a cover up around the vaccine? And 4 to 1 in 5 people either believed that was true or believed it was possibly true. So that's like a quarter of our population that thinks there's actually a possibility that people have died from the vaccine and we're hiding it, which is not true. So that's I found quite shocking to think it's up to 1 in 4 people. And then the other thing they asked was about, do you think that there's potentially a microchip in the vaccine that's been injected into you to monitor your behavior? And the stats were very similar to that. There was, again, sort of 1 in 4, 1 in 5 people that either thought it was for sure true or possibly true that may be going on, which is, not plausible. Microchips are not small enough to go in a vaccine or through a needle. So the technology doesn't even make sense for that. And obviously that's not happening. But again, to think that many Canadians are unsure, I think it just shows you how effective the misinformation movement has been about undermining belief in experts, undermining sort of, authority in healthcare professionals, but also just sowing those seeds of doubt and conspiracy in people's minds enough so that they're really left with uncertainty. And that's, I think, concerning. I think we're going to see ongoing health impacts from that. Already we're seeing a drop off in routine childhood vaccines in this country. You've seen a decline in vaccination rate higher than what we've ever seen. 1 in 4 Canadian kids is behind on their vaccines. And globally, we're seeing this as well. It's actually at a level where the WHO is concerned it could be the next health crisis. Because we're going to see a reemergence of these diseases, a lot of which most people have never seen, but they're not diseases you want to see. So I think we're moving backwards in terms of prevention and health. And that, to me, especially as a pediatrician, is really, really scary because vaccines have changed the face of pediatrics. Before we had vaccines, many children died. You just need to walk around a graveyard from the 20s or 30s and look at the number of children's graves. These were serious things that killed people. And now, it's so uncommon, thank goodness. So it's really heartbreaking to think there might be families and children suffering because of the spread of misinformation.
We're in this phase now, the living with COVID phase or the transition phase, depending on how you want to sort of define it. But what does that mean to you? And what does the next little bit look like maybe?
I think it is a really challenging phase we're in right now. Clearly the pandemic is ongoing in that there's still, high spread of COVID. It's everywhere, but it's not reflected at all in the testing or the numbers that are being put out anywhere across the country because so few people are being officially tested. So we're using other things like wastewater signals, other ways to try to ascertain what the spread is like. We're monitoring things like hospitalizations, which right now are sort of upticked a bit, but nothing, that's dramatic at this point. We've obviously seen a lot of the mandates around public health mitigations removed, which again, I think is confusing. It doesn't mean that those things aren't still recommended, but they're no longer mandatory. And when you walk around, you can see most people have stopped doing a lot of those things. So I think we're in a place where we're sort of challenged to know how to keep moving forward and what all this means. So I think it's tough. I also think it's tough because there's so many different voices saying different things, right? And even amongst healthcare professionals right now, you've got really a range of opinions about what we should be doing and about how we should be managing this phase of the pandemic. So I don't think it's an easy time. And I think it's because we've never been in a pandemic in modern times where we had this much information. So, we're really trying to balance all the things. And I think we're struggling to see some of the things put in place. A great example would be things like better air quality. If we could invest in something like that, it would make sense not only for COVID-19, but all other viruses down the road, right? If you're in a building with good air filtration, good air turnover, that's have positive impacts. But we've really struggled to kind of own that as being in there. It's an issue with masking, right? If you're in an indoor crowded space, it's going to make sense to be wearing a mask. That's going to bring these things down. And not only COVID, other viruses, but because masking out of a mandate, kind of people didn't want to do it. And when you look around, very few people are doing it. So we're sort of struggling, I think, with how do we sort of keep some of these things in places, do some new things like focus on good air, keep things like masking sort of prominent to try to just keep numbers lower and protect people who are more vulnerable. And at the same time, recognize that, returning to our lives, being able to be around people we care about, do things matters too. There's been a big mental health impact of this pandemic. That's clear. And I don't, by no means do I think, locking people down or having people not do anything is a good idea. But how do we, I guess the right word is mitigation, right? How do we balance these mitigation things that we could be doing with this return to our lives, and what's that right balance? And I think that's what we're going to be struggling with the most over the coming weeks and months is that conversation is what are the mitigation things that make sense? How do we utilize and how do we maybe pivot to and from them depending what's happening with the pandemic? And at the same time, recognizing that people need to be able to live their lives. Also, there's been huge, economic, social learning impacts from this, and those things aren't benign either. So it's really, we're just constantly back and forth between risks and benefits of any decision. And I think that's why it's so hard right now for anyone who's having to make those decisions in the public sphere is there's no one decision that's going to make everybody happy, right? So I think it's about moving forward with mutual respect, being kind to each other, being mindful of the people around you and their needs, having these conversations, and just each of us really trying to treat each other with tenderness and kindness, right? Because it's been a really tough 2 years, and I think everyone's been impacted in a different way. And there aren't any clear answers, but I think there's things that we can be still thinking about to try to help us as we move forward. And those things aren't only going to help us with COVID, they're going to help us with influenza, respiratory syncytial virus, many other viruses that spread around. So there might be ways that we can improve the health of our population more broadly also.
Well, thank you so much for your time today, Katharine, and thank you.
Thank you. I really appreciate you having me back on, and hopefully the conversation is helpful for folks.
Yes, it certainly is, and we're all very excited for the arrival of the vaccine in the territory.
Yes, for sure. Me as well.